The Eastern District of Texas has taken a major step, we think, in fighting Medicare fraud and abuse. Last week, a Tyler grand jury indicted 12 persons engaged in a scheme to buy and sell Medicare patient information to enrich themselves at the expense of the American taxpayer. Today, this morning, I should say, agents and officers fanned out all over communities in East Texas, and we have arrested 10 of those 12 individuals. The two remaining folks on your list that we have not captured yet or have otherwise turned themselves in, Miyoshi Goodwin, who is from Tenaha, Texas, and then Marcus Chukwu, I hope I'm pronouncing his name right, who actually, based on our best information, is back in Nigeria where he's from. The other 10 are safely in custody. All the officers are safe, and in fact they're making their first appearances in Tyler federal courtroom this afternoon. They are charged by the grand jury with paying and receiving kickbacks in exchange for steering Medicare patients to a home health company that Grace Mathali owned called Three Angels Home Health. The company was located in Houston, but many of their so-called patients were located here in East Texas. The allegations in the indictment state that between August 2013 and November 2014, Medicare paid Three Angels Home Health Care over $2.5 million for home health services provided to approximately 250 East Texas Medicare patients. I'm pleased to tell you, though, that during the prosecution of Grace Mathali, the agents were able to recover, I want to get this right, approximately $710,000, and along with the conviction and sentencing of Grace Mathali, that money has been forfeited and will be returned to the government coffers. This scheme spread across a vast portion of East Texas, including Tyler, Jacksonville, Marshall, Nacogdoches, Lufkin, San Augustine, Tenaha, and even other smaller areas. As the indictment against the individuals alleges, the defendants worked as recruiters for Grace Mathali and her company, Three Angels. They were paid approximately $500 each for each Medicare beneficiary or patient they could sign up for Three Angels. To induce the Medicare patient to sign up, the recruiters would then offer and pay that patient between $100 and $200 to sign up for the home health service with Three Angels. There are also allegations in the Mathali case, as well as in this case, that the required certificates of medical necessity were often fraudulently obtained from doctors who had never seen these patients, or frankly, they just lied to Medicare that they were there in the first place. In other words, many of these patients, the 250 that we've talked about in the indictment, were not even eligible for the home health care which Medicare paid for.